The more we use them, the more we lose them. Konting lagnat, konting sipon, antibiotics agad. Sir Pharmacist, meron ba kayong antibiotics para sa tigyawat? At ang pinakamatindi is, Sir Pharmacist, hindi ko na po tinapos yung antibiotics ko kasi okay na ako. The World Health Organization or the WHO has declared AMR as one of the top 10 global public health threats facing humanity. It can affect anyone of any age in any country. So ano nga ba yung AMR or antimicrobial resistance? So antimicrobial resistance or AMR develops when a bacteria, viruses, fungi, or even parasites evolve over time and lose their ability to respond to antibiotics, making infections more difficult to treat and raising the risk of disease transmission, severe illness, and death. So sa madaling salita, hindi na gumagana yung mga antibiotics natin sa mga karaniwang sakit. So these antibiotics and other antimicrobial medications become ineffective as a result of drug resistance, and illnesses become more difficult or impossible to treat. People who are taking medical treatment or who have weaker immune systems are at a higher risk of contracting an infection. Antimicrobial resistance occurs naturally over time through genetic changes that microorganisms go through. However, it is a growing global threat as the misuse and overuse of antimicrobial agents accelerate this process. It has been noted that the rate of mutation of drug-resistant microorganisms far exceed the rate at which we develop stronger antimicrobials to counter them. This is where the bulk of the threat comes in. We are rapidly approaching a point of time where no viable antimicrobial agents is available to manage superinfections. And baka dumating na rin yung panahon na wala nang magamit or wala nang maging effective na antibiotics, lalo na sa mga future generations natin. The most common example of misuse prevalent is the use of these antibiotics in conditions which do not necessarily need them, such as the common colds and the flu. Another consumer malpractice is the non-completion of the therapy duration when the symptoms of infection have subsided, whether or not they have recovered clinically. It is also a prevalent practice to give antimicrobial agents as growth promoters and immune boosters to animals or to prevent diseases in animals which we in turn consume. So these three activities contribute largely to the spread of antimicrobial resistance. Although there are stringent policies and interventions aimed to stop these practices, meron pa rin talagang patuloy na ginagawa itong mga activities na to. Here in the Philippines, we have the National Antimicrobial Stewardship or the AMS program. So this program, it is a coordinated effort in both public and private hospitals in the Philippines to improve antibiotic stewardship. This program, this is essential to minimize the emergence and spread of antimicrobial resistance. So specifically, this AMS program aims to promote rational and optimal antimicrobial therapy, improve patient outcomes, and decrease healthcare costs by reducing unnecessary antimicrobial use, adverse drug events, and mortality and morbidity from infections. So as a patient, as a student, as a family member, what we can do to combat antimicrobial resistance? So we need to use antibiotics only when prescribed by a doctor, and always finish antibiotic prescriptions and do not miss a dose. Never share or use leftover antibiotics. Don't take antibiotics for viruses such as the cold or flu because antibiotics only work on bacteria. And we can also prevent infection by regularly washing hands, preparing food hygienically, avoiding close contact with sick people, and of course, keeping vaccinations up to date. So if you have any questions about your antibiotics, talk to your doctor and pharmacist.